It's time for school days. Hope for moms and dads of school-age kids.
I tell parents, you're like a training wheel on a bike. Your job isn't to make the bike move. Your job is to keep the bike upright.
Those of us who are the true educators, we really want to be given the opportunity to educate the whole child.
We can get free college degrees based on all of the opportunities that are out here and available to our students.
Oftentimes, as parents, I think we want to protect our kids, but I think one of the greatest gifts we can give them is allow them to experience adversity.
Yeah.
Here's your host, Danita Bailey.
Well, good evening and welcome to School Days, Help for Moms and Dads of School-Age Kids. I'm Danita Bailey. In the spring, we had invited today's guest to talk to us about the cold and flu season until suddenly we found ourselves smack dab in the middle of a global pandemic. So we postponed the show so that we could talk about how the game has changed in light of the novel coronavirus. In my research for this episode, I came across this passage on the CDC website that perfectly explained why this cold and flu season is going to be so complex for parents and students this year. It reads, "The exact level of effectiveness of symptom screening in schools is not known at this time. While screening may reduce some SARS-CoV-2 transmission in schools, transmission may still occur because of asymptomatic, pre-symptomatic, and mildly symptomatic students. Additionally, because symptom screenings will likely identify individuals who have symptoms that are unrelated to COVID-19 and at times unrelated to any infectious illness, students may be inappropriately excluded from school, which may cause unintended harm. It is because of these limitations that CDC does not currently recommend that universal symptom screenings can be conducted at schools." So the complexity I'm referring to is what was just described here. It's the dilemma that parents find ourselves in, and we just want to know, is it cold, flu, or COVID-19? So before we go any further, let me just say, it does take a village. If you hear a great parenting tip or nugget of advice, share it with your parent friends. Facebook it, Instagram it, tweet it, link it in, and add the hashtag #SchoolDaysShow and hashtag #IamSchoolDazed. And also, we do want you to be a part of the show. So if you have any questions or comments, give us a call at 214-444-5575. Or if you are live with us on Facebook, you can drop us a question there and we'll do our very best to get to you as soon as possible. So let's jump right in and introduce our guest. Today's Kidcaster is 8th grader Parker Allen from North Texas.
Dr. Ahmad Anwar graduated with a BS in microbiology from the University of Texas at Austin in 2002, and then she earned her medical degree at the UT Health Science Center in San Antonio in 2007. She went on to complete her pediatric residency training at the Children's National Medical Center in Washington, D.C. in 2010. After her residency training, she worked as a pediatric hospitalist at Children's Medical Center in Dallas, specializing in the care of hospitalized children. She served as an assistant professor of pediatrics at UT Southwestern Medical Center until 2014, and then she transitioned to the world of outpatient pediatrics. She has been the primary provider at the Pediatric Center of Grand Prairie since 2015. Dr. Ahmad Anwar is an active member of the American Academy of Pediatrics. She is a strong believer in the practice of evidence-based medicine. She strives to continually provide the highest level of care possible for her patients. Dr. Ahmad Anwar lives in Coppell with her husband and 2 sons. She is always eager to learn and grow as a physician and takes pride in building relationships with her patients and their families. Welcome to School Days, Dr. Anwar.
Thank you. Thank you for that introduction.
So we are still, and I say we because David is supposed to be here. Apparently we're having some technical difficulties at home, and by that I mean a kid is going nuts. So we're hoping he will jump in with us a little bit later. So we'll see. I don't know. But Dr. Anwar, you are our pediatrician.
That is right.
Yeah.
Honor to treat your 3 kids. Yeah.
Yeah.
I remember one of the first times you came in and your youngest had like a perforated eardrum and you were like, there's this stuff coming out of her ear and I'm not sure what to do.
Yes, you're right. Christina kept having ear infections, and so yeah, we were on the struggle bus there. So we got to see you a lot in those early days.
Yes.
That was
Yes.
7 years ago because she was a baby when we first started seeing you,
She
right?
was young, yeah. So we've been there for 5.5 years. So it was probably around that time.
Oh, okay, okay, yeah, because I was at the Las Colinas one before, and when I found out there was one in Grand Prairie where we lived, I was like, oh, this is awesome. So anyway, I have so many questions for you. So let's just jump right in. I don't think we'll be able to get to them all, but we'll do our best here. So, okay. Do people, and I'm kind of tongue in cheek saying this, do people get regular sick anymore?
Yes. So they absolutely do. But I think in this world of COVID, it's kind of complicated that. And so it's hard to say. So a lot of times when kids get sick, we always said it's likely a virus. Now, which virus, we can't always tell you, but the symptoms sound viral and this is what you look out for. But yes, now with COVID, that has definitely changed things. But we are still seeing regular sick. We are seeing colds. We are seeing allergies. We haven't started to see a whole bunch of flu yet, but that's coming. And then we have seen COVID, we've seen stomach bugs, all of the same kind of things. But definitely with COVID in the forefront of everyone's minds, it makes it a little more difficult to kind of tease out exactly what's going on.
Right. So the people I've heard a lot on TV and just other places that getting the flu shot this year is very important. Can you kind of tell us what the reason for that is?
Absolutely. So, I mean, flu is a small pandemic that happens yearly, and we lose thousands and thousands of people to the flu every year. So this year it's kind of been referred to as the twin-demic because we already have COVID going on, and then influenza season is upon us. So we are nervous about what's going to happen if people are potentially infected with both infections, viral illnesses at the same time, flu and COVID. It could be really scary, and it could cause a lot of deaths, and it could cause a lot of respiratory symptoms, a lot of hospitalizations. So this year particularly, we are really pushing, we always do, but this year particularly, we're really pushing for the flu vaccine because that is a virus that we have a vaccine for, that we have established treatments for, and we know how to manage it. So really getting your flu vaccine is the most important thing to kind of help, not 100% prevent you altogether from getting the flu, but what I usually tell my families is the biggest reason you're getting your flu shot is to help prevent the serious complications of the flu, to prevent the hospitalizations from flu, to prevent flu deaths. Because I see it year in, year again, where kids who get the flu shot and end up with the flu, they are much less sick than the kids who don't get the flu shot at all. So this year it's more important just given COVID.
And oh my goodness, I had not even thought about the possibility of getting them both at the same time. That is terrifying. And we have asthma in our house, as you well know. And so we always get a flu shot because we know that it could be very complicated if we do end up getting the flu. And so we're very careful about that. So important to get the flu shot. I did read a study that said that 1 in 4 parents are hesitant about getting their kids vaccinated against seasonal influenza. So is the flu vaccine safe in your professional opinion?
Absolutely. It is safe. Now, obviously, any vaccine is not without, some side effects or some risk, but we always say that the benefits completely outweigh the risks. So we give flu vaccine. We already have it in our office. We've already been giving it for about a month or so. I haven't had feedback from families that they're having any other side effects than what's typical, which is usually a little soreness in the arm. But it's very safe. I hear year and year again that flu vaccine makes me sick. It shouldn't make you sick. It's generally the shot is inactive virus, so it should not make you sick. The nasal spray is live virus, Some clinics have that and you have an option for both, but there's certain indications for which you would use the flu shot and certain ones that you would use the live nasal vaccine. But across the board, yes, giving the flu vaccine is very safe.
Okay, good to know. I mean, we're a team flu shot over here, so
Absolutely, yeah. And,
Okay.
and I get it every year. I give it to my kids every year. So I mean, I always tell families that I mean, I give it to my own children. I wouldn't if I had any hesitations about it.
Yeah, absolutely. That's important to know. I always ask that. What would you do with your family if this was
Yeah.
going on? So yeah,
Right.
that's helpful. Okay, so just, jumping into coronavirus. So I read that little blurb from the CDC website about how difficult it is to tell the difference, and why they're not recommending widespread screening that schools do themselves. So how can you even tell the difference between the novel coronavirus or quote cold or flu or allergies even?
Yeah. And that's a really great question. And unfortunately, there's not like an easy answer. So a lot of the symptoms amongst all of these things are going to be similar. So COVID and flu probably are the most similar of all. Generally, with flu and COVID, you're expected to have fever, you're going to have body aches, headache, cold symptoms, so cough, congestion, runny nose, sore throat. The predominant thing that they're saying with COVID is you tend to have the loss of taste and smell, and you can have chest pain and shortness of breath, which you could have with flu, but it's more likely with COVID. Now, there are some kids that are exhibiting those symptoms, but in kids, we've also just seen very mild symptoms that are very much like any other cold virus, mild fever, cough, congestion, runny nose. So usually with a common cold, you're not going to have all the generalized symptoms. Usually you're not going to have the body aches, the headache, the fatigue that comes with the other ones. And then with allergies, what you would expect is you definitely don't have fever with allergies.
Right.
And you may have some other kind of telltale symptoms like sneezing, watery eyes. Well, hi, David.
Why do you have a mask on? Where are you? Oh, his audio is
He's
coming
There I
up.
am.
there.
Yes.
You go.
Why do you have a
What's-
mask on?
What's the episode about today? I mean, Dr. Anwar, isn't this about the COVID-19?
Yes, you're right.
episode
You are
and-
correct.
And how do we reduce the spread of COVID-19?
Absolutely. That's great. Yeah, it's great. Wearing a mask. You're doing.
Yeah.
But is that a real mask or it looks like a?
Yeah,
Okay.
it is a real mask. It just doesn't have it on. You are nuts. Oh my gosh.
No, this is a virtual background mask.
What?
Yes.
That.
Okay. Great.
I'm just modeling what we're supposed to be doing. So
Okay. Oh, I see it now. See
Yeah.
I had a
Yeah.
piece of equipment that was kind of covering you up a little bit. Can you turn your the computer down so we can see more of you?
oh sure.
Yes. Okay, and then a little more headroom. There you go. Awesome.
Well, there we go.
I'm going to have to cut
All
this
right.
out of the podcast the audio podcast, but I'm sure people
Hey.
online are like, haha.
Yes. And I'm David Bailey.
Yes, we skipped all of that.
Oh, you already missed all the. I missed all the banter and everything. Okay.
Yeah, well, we had to move on. So if anybody's listening, the reason why David is late is because we had an issue with a child, apparently, that I don't know about. I'll find out later. So we're glad you could join us.
Yes.
So Dr. Anwar was telling us, we were talking about allergies and COVID-19, and she was in the middle of saying that you definitely are not going to have fever when you have allergies.
And then you may have some other like telltale symptoms like sneezing, itchy, watery eyes, and I would expect that if it's allergies, you have a history of allergies, either seasonal or year round, that might be worse after it rains or might be worse on a windy day. And your symptoms should resolve with an antihistamine or an over-the-counter allergy medicine. So if you take that for a few days and that's not relieving your symptoms, then it's not likely to be allergies.
That is so good to know. I do have several friends who said that they thought that they had allergies and they in fact had COVID-19.
Wow.
Mm-hmm. Yeah.
So usually you would expect the symptoms to be a little bit more severe, but I mean, what we're seeing is people who are asymptomatic and literally have no symptoms. They get tested for some other reason and they end up being positive. And then we've seen people who are so sick that they're put on ventilators and ECMO and things like that. So there's like just such a range of symptoms, which is what makes it hard to really, to understand, and that's why things keep changing.
Mm-hmm. Mm-hmm. Yeah. So the schools are telling parents to self-screen, which is honestly part of the reason why I did not want to go back to school. Not only just because I didn't feel like it was safe, but then I thought it's already hard enough for me during cold and flu season to know whether or not I need to send my kid with the cough or my kid with the tummy ache or my kid with the whatever, not the fever. That's kind of obvious. But there's, around this time, we all have allergies and it's already difficult to tell the difference between cold, flu, and allergies. But then now we've thrown in COVID. So parents are being told to self-screen. So when should a parent opt to keep their child at home, and what does self-screening entail?
Yeah, so good question. And I think even there's not clear guidelines for that, but generally what we're saying is you should be taking your child's temperature before going to school. So over 100.4 is definitely a fever. And if there is a fever, your child should not be going to school. I know it's difficult in this day and age, and there's always that parent who's going to pop some ibuprofen and send their kid off to school. But just given the risk with everything going on, we just really have to think about our community and just society in general. We really have to take responsibility to make sure we do the right thing. So fever is a definite no-no. Now, some schools are even opting to have a slightly lower temperature threshold. So I've heard 99.6, I've even heard 100.0. So even though that's not considered a fever, but it might be low grade, and that might be worth keeping your child home. And then definitely symptoms of not feeling well. So some of the things we talked about, if your child is complaining of a headache, fatigue, body aches, sore throat, cough, congestion, runny nose, especially if all of those things are kind of coming on together, I would say if your child wakes up in the morning and doesn't feel well, then it's probably a better idea to keep them home that day and monitor and see what happens. In this case now with COVID, I think we just have to be extra cautious than we would in the past.
Right.
Like I said, for allergies, if you think it's allergies, then give allergy medicine, and it should help to relieve the majority of the symptoms. So if that doesn't work, then it's probably not allergies. And then you probably need to seek medical advice for your specific child and their symptoms.
So does that mean if they have some sort of allergies that we think are allergies, we need to medicate them and keep them home for a couple of days?
At least I would probably for a day, like if they're regularly on allergy medicine and you're giving them something regularly and then they have symptoms on top of that seem a little out of the ordinary for allergies, then yeah, for sure, because then that could be like a cold virus. Now, if the symptoms sound consistent with allergies, usually 1 or 2 doses of an antihistamine should help to dry stuff out, So if it's sneezing, runny nose, like some post-nasal drip from allergies, if you give 1 or 2 doses of an antihistamine, they should get better, and that should really kind of fix the problem.
Yeah. As far as any kind of exposure or close contact with anybody, what are you telling your parents of your patients?
So yeah, that's another great question. So basically, if you have had close contact, which means somebody in the household, somebody that you have been in contact with less than a 6-foot distance for more than 15 minutes at a time, and that person tests positive for COVID, then you are considered a close contact. And all of those people should self-isolate for 14 days, regardless of symptoms and regardless of testing. So I've heard the scenario even this week in my office where an older sibling tested positive and the younger sibling doesn't have symptoms, so mom wants to get him tested so that they can go back to school. But in this scenario, when you are in the same household as someone who has tested positive, then ideally the whole family needs to isolate. And part of that reason is with COVID, as with flu, you can be contagious even before you start to show symptoms. So we usually say it's like 24 hours with flu, but with COVID, it seems like 24 to 48 hours before you even start to show symptoms, you may be contagious and spreading it to others. You typically develop symptoms within 5 to 7 days, but it does appear that people with COVID could still be contagious and develop symptoms as late as 14 days, which is why that 14-day number has come about.
Wow. Okay.
So once you opt to get testing either for yourself or for your child, and I'm not sure, you probably have more information on this than I do, but the turnover from when you're tested to when you get the results, and does it have an impact? Because you may get tested, and the window of time could be several days, and then in the interim, while you're waiting for the results, you could think you're negative or whatever, and then contract it, or maybe test negative and then contract it. Then you get results back saying you're negative, but then maybe between when you tested and when you got the results, you in a pot. So I'm as
right.
Can you talk about that a little bit?
No, you're absolutely right. And that's part of the complexity of this whole thing. So yeah, generally, so early on, we had limited tests. And so testing options were very limited, and they had very specific criteria for testing people. I think now as more tests have become available, it really is like a case-by-case basis. So at our office, we have the ability to do a rapid COVID test. So it's like a rapid antigen test, kind of like the flu test you do in the office. We get results within 15 minutes. And if it's positive, it's highly positive. But the problem with it is it has a high false negative rate. So if it's negative, it could be a false negative. So we, at the same time, we're also swabbing to send the COVID PCR test, which is a little bit more accurate. Now, that's also not 100%. So there's always a possibility of false negatives, but that is definitely the more accurate of the two tests. Now, there was a period like about a month or two ago where that turnaround time was like 7 to 10 days, which was really long.
Oh my goodness.
And people obviously weren't waiting for their results. They were kind of waiting for a few days and felt okay and were out and about. The turnaround time has gotten better. So right now it's generally 2 to 3 days to get those results. And then there's also another test, which is the antibody test. So that's also different in that doesn't test for acute infection. That's actually a blood test that's testing your level of antibody, if you have antibody to the COVID virus. So it is indicative of a past infection, that you've been recently infected with it, but it doesn't tell you anything for the immediate, like if you currently have symptoms. And then as far as testing, and that's a hard one too, but generally we say it is better to wait a little longer before you get tested. So the roundabout time is about 4 to 5 days after you've been exposed is a better time to get tested. But you're right, there are people who were exposed, they went ahead and got a test and didn't have symptoms, and then their test was negative, and so they think they're in the clear. And so they're going about regular life, but they end up 4 or 5 days later developing symptoms because they got tested too early. But two, you can also have that false negative.
Right. Let me ask you about the antibody test. So we know quite a few people who have gotten COVID, and if you have, first of all, do you automatically get antibodies if you have had a past infection with COVID-19? And second of all, how long are you safe? How long do those antibodies protect you from being reinfected?
Yeah, so you do automatically make antibodies, and that is a process that happens with any infection that you have. Your body makes antibodies to it. There's different levels. There's one that you make that are more in the acute part of the infection, and there are ones that kind of last longer. Now, the question about how long your immunity lasts, that is still up for debate. So there are some people saying that the protection might not last as long as we would hope it would, that it may only last months at a time. And so then somebody could potentially be reinfected. Now, another thing we hear about is people who test positive, they seem to get better, and then they, for whatever reason, get retested within 3 months, and that test is still positive, but they may not be having symptoms. That is still considered like a prolonged positive test, but it's still considered part of that first initial illness and that first positive test. So you may still continue to test positive for up to 2 to 3 months is what I've heard after your initial infection. Some people, not everyone, but some people do. But yeah, the question of immunity, we're still not sure about.
If you're testing positive, how do you go back to work?
Yeah.
How do you go back to school?
So that's a really good question. So generally what we say is if you have had symptoms and you test positive, then you need to isolate or quarantine for 10 days from that positive test or from when your symptoms start. And it needs to be at least 10 days. Your symptoms need to be improving, and you need to be fever-free for at least 24 hours before you are considered non-contagious and you can go back to work or school. So as far as continuing to test positive, what they think is that these people just have prolonged shedding of the virus from the nares or the nasopharynx, but they are not considered contagious. So they may have prolonged virus living in the system and that it's still shedding and detectable when you do a swab, but that it's not enough to infect somebody at that point after that, initial 10-day period.
So do you need a note? Like if that happens to your child and they're, a month after they still are testing positive, then what has that happened in your practice, and do you get a note? Or
I haven't had it happen with a patient. I had it happen with a patient's mother, who actually tested positive pregnant, and then she quarantined, did what she needed, but even right before the delivery, they retested her again and it still came positive, and they consulted an infectious disease expert who said, no, it's fine. She's not actually contagious. So that is another thing that has changed over this process. Initially, we were requiring a negative test to return to work or things like that. But because we were doing so many tests, and like I said, a few months ago, since the system was so clogged up and the results were taking so long, they actually moved away from this test-based return to work strategy. And now they're doing more of a symptom-based strategy where they're using the 10 days since your symptoms start, an improvement in symptoms, and fever-free for 24 hours. And then even for the people who test positive but had no symptoms, they were asymptomatic, they need to wait 10 days from that positive test before they're considered safe to return. Gotcha. So we're generally not recommending retesting to return to school or work.
Okay, gotcha. All right, so I need to know the process. So let's say my child goes to school. I get a note from the school saying Sally or somebody in your class has tested positive. So now what do I do as a mom?
Yeah, so you call your pediatrician, and then we have a discussion basically about what to look out for. Now, part of it depends on if it was someone in the class and how in close quarters they've been, or if they've been maintaining some social distance. That makes a difference. Generally, we have been opting to test those kids. Now, if they're asymptomatic, it's probably better to send the PCR versus the rapid test. But again, ideally, you want to wait 4 to 5 days since the exposure to have a more accurate test result. And then basically you monitor your child. You monitor to make sure that they don't develop any symptoms. So if they develop symptoms of fever, cough, congestion, runny nose, body aches, headache, then that sort of changes the whole game plan.
Yeah. Do you have to get a test if you have been exposed? Because you're going to have to quarantine anyway, so...
Right. Right. So no, you don't have to get a test. But yeah, as long as people are doing their job and quarantining the way they're supposed to, you don't have to technically get a test. And that's what I've told families as well, is if someone in the family has it and then somebody else develops symptoms, then it's pretty much, guaranteed to be COVID. And then the plan will remain the same, is everyone needs to isolate.
Yeah. Changing gears just a little bit, I know that there has been, we were talking just beforehand, you and I, Dr. Anwar, about how some people think this is a hoax. And also there has been kind of a push to return to schools, I think partly because children seem to be getting milder symptoms or asymptomatic. And so can you just anecdotally, or I'm not sure what you can do, but just tell us, how often do we see children with more severe symptoms, even to hospitalization?
Sure. So that's a great question. And yeah, generally speaking, we have not seen children with they're not getting sick at the same rates as adults are, and they don't seem to be having as severe symptoms as adults. Now, part of the question is that have anything to do with the fact that they haven't been in their normal environment, because they haven't been in schools? And that's usually how we see these things spread, because when one kid in a classroom gets flu, it spreads like wildfire through the class and through the school. So part of the question is that at play? I've also heard theories about kids not being as susceptible to COVID because, it is a form of coronavirus. And so coronavirus, there are many strains of that are known upper respiratory infections that are common, that we see all year long. So that maybe they have some, immunity because they're constantly exposed to these common cold viruses as well. But yeah, I kind of have some numbers. What this recently came out just the beginning of September from the AAP, but they said that cumulatively there had been a little over 500,000 total child COVID cases reported. So that's about 10% of all cases. And the numbers that I saw most recently was like 120 deaths in kids younger than the age of 21. So it doesn't mean that a kid can't become severely sick, but the numbers are generally showing that they're not getting as severely sick. Now, that being said, there have been children that have been admitted to the hospital. One of the big complications that we're seeing is the multi-system inflammatory complex. So that is one of the things that they're seeing. They're still trying to understand a little bit about it, but what generally the kids who have been diagnosed with that were also positive for COVID or had been exposed to someone with COVID, and it causes, general inflammation throughout the body. So in the brain, in the heart, the kidneys, the skin, there's certain symptoms that they have and certain lab criteria that they have. And that has been one of the big complications we've been seeing in children.
And is that a form of Kawasaki's disease?
So yeah, it's very similar to Kawasaki disease, which has been a known entity. We don't know what causes that, but part of the thought is that it may be, viral triggered, and it kind of causes the immune system to kind of go into this inflammatory state. So this is very similar to that. And so it's a new thing that's kind of come up since COVID started. And that's kind of been the big complication we've been seeing in children. A lot of the deaths have been associated with that as well.
Yeah.
So I was just literally today in my algebra class introducing my students to exponential growth and how things we talked about music videos and how they go quote unquote viral. Just kind of a little introduction to the math behind that. So with kids having less symptoms and it's not as severe, the math in me says, well, let's say they do have it, don't know it, or not as severe, but you have families that may have second and third generations living at home with them, elderly, going to visit their grandparents, just hanging out. Is there any data on the correlation between children and the more immunocompromised family members that may be catching it secondarily. Then also, the math in me says, well, the reason why we haven't had as many cases is because, to your point, they've been at home. Now we're having millions of kids influxing back to being around each other, which they hadn't had before. Well, I say, well, the reason they've been sick is because they've been around each other. Now we're going to have more people getting in, which is, and to me, I'm going to predict that it's going to have a rise in cases now with millions of kids back around each other again, not social distancing, things like that. So I guess what I'm asking is, with all that said, is there any trends or what you're seeing as far as how many more kids may get sick, and also the secondary, residuals of how it can impact other family members?
Yeah, no, absolutely. I don't have data about that. Now, generally, kids are usually considered to be the transmitters of disease, like especially with flu. We always say kids are the germ carriers and they're the ones who get everybody sick. I think we will see with this. I haven't seen a ton of COVID in kids, but the kids I am seeing are generally actually getting sick from another family member. So from a parent who has it or an older sibling who has it, and then the younger child is getting it that way. But absolutely, I mean, when we talk about, our kids potentially being sick, and yes, hopefully they would have a milder illness, but if a parent is giving their child, fever medicine and sending them off to school, we have to think about absolutely the teachers. What if there's an older teacher there who gets very sick from it, or another child who gets it, who then takes it home to somebody who's older or has underlying health issues? Absolutely. I mean, it's a big concern for sure.
Yeah, I know. In the school that I teach in, like, our students they're staying in their classrooms all day long, so the kids don't rotate. So we're 6th, 7th, and 8th graders. They don't rotate, the teachers do, which I think would help to reduce the risk. But I tell my kids, we're still trying to see if I can stay home because I might physically, have symptoms. I'm not more susceptible, but with my wife and my son there. But if I do have to go back, I tell my kids, look, you're gonna see the back of my head in the classroom. We're gonna log in together and we're gonna do our work, but I'm not gonna be walking around and hanging out with you guys, just because I think that's just the safest way to keep everybody safe. We're gonna have medical scrubs, a face mask, and a shield. So it's gonna be like I'm like in a movie or something, like from an outer space movie there. But it just it's they're kids, and so I think of middle schoolers can probably handle it. They can get kind of silly at times. High schoolers, I think about like the younger babies, like the kindergartners, 1st, 2nd, 3rd graders. What tips do you have for parents to help their children understand the importance of protecting themselves and
Yeah.
But kids are going to be kids, so it's just
kids are going to
hard.
be kids. You're absolutely right. And I have younger ones myself. And like even the rare times we do go out and they're wearing a mask, my little one is constantly touching it. And I'm like, stop touching the mask. So yeah, it's a struggle and they don't really get it. I mean, they understand the concept of COVID. And I think most kids, regardless of how young, have kind of understood what's been going on the last 5 or 6 months. I think, yeah, the biggest things are regular. It's regular hand hygiene. So teaching them how to properly wash their hands, and just kind of teaching them the concept of germs and things that they touch can have germs. And so they have to be careful about then touching their face or touching their nose. I think wearing a mask is critical. I know it's hard for kids to keep them on, but wearing a mask is really important. And there's very few circumstances that a person should not need to wear a mask. I know people have, fought about it and been up in arms about it. And there are very few circumstances in which a person can't wear a mask. As someone with asthma, someone with allergies, any of those things, they will have no problem breathing. It is a little uncomfortable, of course, and they have to kind of get used to that. But I feel like one tip that I had was having kids practice wearing a mask when they do screen time. So that way, if they want to have the screen time, they have to wear the mask, and they can kind of get used to doing regular activities with a mask on. I think doing play, so for a younger child, like having them put a mask on the doll or putting a mask on the teddy bear so that they can kind of see that everyone is doing it. I know on Facebook this past few months, there's been like a post about, it's like a germ thing where in a bowl of water, you put a bunch of pepper, and then the kid puts their finger in, and the pepper all sticks on the finger, and then they dip their finger into a little bit of dish soap and then put the finger back in that same bowl, and the pepper kind of moves away to teach them about germs. So I think they can get it, but obviously it's not perfect. So part of it also is in classrooms the best they can, trying to keep them physically separated as much as possible. I know some schools are doing the desk shields, having them stay in the classroom as much as possible, but it's going to be a challenge. And you're right. I mean, I think schools have just now started going back these past few weeks. So I'm also curious to see what's going to happen over the next, 2 to 4 weeks with the numbers.
Along the...
Yeah, no, we totally... Oh, I'm sorry. Our school, we totally reconfigured the desks for every single classroom to ensure that it's truly 6 feet apart. And I believe we're going to have, the shields that you're talking about as well. And so the number of kids going to be able to be in any given classroom is going to be much, much smaller than what it was in the past as well. And so it's just interesting. And I'm just sitting back and I'm looking, in this, the math in me is analyzing and freaking down, okay, what's going to happen here, but we won't fully know until we know. And so, I think probably as we hit October-ish or so, it could change. Let me ask you one quick question. I know Baby had a question, but so some districts are going back now, some are going to hold back until October. With them going back in October, they might say, okay, we're free and clear, but now are we moving into flu season as well?
Yeah, absolutely. And I think we were talking about that before you joined us, but yeah, absolutely. October is hitting flu season. And so that's one of the things we were talking about, is why it's so critical to get a flu shot this year, is we're really worried about people being co-infected with both viruses at the same time, and how devastating that could be. I mean, we may see less flu cases if people are generally wearing masks. That's another thing that we may see. I hope that's the case, because, as a society, we've never worn masks in public. In several Asian countries, that's standard, and you always see people doing that. So we may automatically from that see less flu cases this year, but because we have a way to protect yourself from it with a flu vaccine, I think it's really important that everybody get one.
Is it time right now to get that flu shot?
Absolutely. So yeah, the sooner the better. Definitely before the end of October is recommended. So that's kind of when we start to see flu cases rise. So you want to have your flu shot before that happens. And basically anyone 6 months and older is able to receive a flu shot.
Okay. So we have a ton of questions here about the spread. That's kind of been a controversy that's happening in our nation and really across the world about how this is spread. And then they've changed how it's been spread. Now they're saying it could be airborne and things like that. So I have a couple of questions, but I do want to start with something that parents might be concerned about. What is the best way to care for your child with COVID-19 and be safe? Because you can't, when you're a parent, you can stick yourself in a room for 14 days and not emerge.
It's much easier when it's an adult who has it and they can sort of quarantine. When your child is sick, your child wants to love on the parent and be all over you. And so it is difficult. It is difficult. That's not an easy one. I mean, but you want to take the same general precautions. I would recommend wearing a mask around a child who has it. I would recommend frequent washing of hands, especially when you're helping blow noses and like you're dealing with any kind of body fluids, that kind of thing. You want to disinfect high touch surfaces. So the dining table, chairs, doorknobs, remote controls, the bathroom, light switches, things like that. You want to make sure to kind of decontaminate all of that. I think it's a lot harder though when the child is the one who's sick with it.
Let's be real, that everybody's going to get COVID, right? I mean, if your 7-year-old gets COVID, it's just, is there a chance that you're not going to also get it?
Yes. Honestly, yes. I've had families who have come in and like the mom and one child got it and the dad and the other child didn't get it. So it is possible. But yeah, it may be a situation where a lot of people end up with it, but hopefully not.
Yeah. Okay, so tell us, how does COVID spread? I know this keeps changing, but what do we know?
It has changed. I mean, I know there's been some reports about potentially being airborne. I think that is not confirmed yet, and I think it's less likely to be that. It's generally spread from contact and droplet. So droplet is the big droplet precaution. So when a person coughs or sneezes or even talks or shouts loudly and, stuff is emitted from your mouth, those particles can then spread the virus. So that's the primary way. And that is why wearing a mask is so important, because if I have a mask on and you have a mask on, then when we are talking to each other, we are sort of limiting that. That is also why physical distance is important. So 6 feet is it's probably a little bit of an arbitrary number that they've come up with. I mean, I don't think we know for sure that the virus doesn't travel 6.5 feet versus, 5.5 feet, but it's kind of a general guideline that it shouldn't, transmit that far. And then contact is a potential way, but I think that's less likely. So touching a contaminated surface. So if I sneeze or cough on the remote control or the doorknob, or I touch my hand and I touch the doorknob and somebody else touches it, that is also another way. We do know that it's highly contagious. So in terms of contagiousness, it's more contagious than flu. But we don't consider it to be full-on airborne transmission with the contagiousness like a tuberculosis or a measles. Those things are highly contagious and live in the air for several hours. We don't think that's what's happening with COVID, but obviously we'll know more kind of as time goes on as well.
Yeah.
So I have a question about, in the classroom.
Dave?
Oh, yeah.
Did you do something different? Because it's hard to hear you now.
No. Am I better?
Not really.
Hello?
Talk loud.
Hello? Okay. Is there a way in the classroom, because I'm thinking about, I want everybody to be safe. If I go back, is the option of, I know like our classrooms only have windows. Our classrooms have poor circulation. Do those things impact the spread? And also, is having something like an air purifier or something to circulate the air, is it better to have the air circulating or not? Or so, and probably just for anyone at home as well, or any environment we're in, what's the best way to keep air the safest as we possibly can in our environments we're in, to ensure that we're at least reducing the possibility of spreading?
Yeah, absolutely. So yes, actually better ventilation is good and it's protective. So we know that, potentially having they're saying now to, upgrade your air filters that have this, can contain the smallest particle size. You could keep the fans running, on auto so that those are constantly running, having windows open. So good ventilation and good circulation is actually protective, and that's why we think that being outside is also more protective versus being inside, because when you're inside, the droplets kind of just stay in the air, whereas when you're outdoors, there's air circulating and wind and all of that. So we actually think that good ventilation is really important. So that's why part of the return to school sort of recommendations have including as much outdoor activity time as possible. I know it's right now a little hard Texas heat, but as things start to cool down, like even potentially moving classrooms outside and doing more outdoor instruction would be really beneficial in that way.
Yeah, I know. I've been thinking about that as well. What about eating? What about like lunchtime? It's time to eat.
Yeah, so that's another tough time because obviously then you're like directly ingesting anything that you've come in contact with. So that masks have to come off at those times. I think the AAP guidelines were recommending ideally having kids continue to eat in the classroom. I think some schools are doing that, but some schools are having them go into the cafeteria, but having them try to sit spaced out so that they're 6 feet apart. You definitely want to make sure kids are washing and sanitizing hands before they eat. But yeah, eating is a tough one because that's one of the ways you could potentially get sick is if you've touched something and then you're touching your food and you're ingesting it.
Wait a minute. So I thought that you cannot ingest COVID. And
so
you
yeah,
can't
I guess
eat it, right?
Is the wrong word, but
okay,
yeah.
Right.
But if you're touching your face or touching your nose or touching your mouth, then you're also getting some of those potential particles into your body.
Okay, I didn't mean to sound. I just was that's the one thing I thought was safe.
yes, yeah. No, you're right.
Yeah.
That was the wrong word.
Okay, yeah, good. Just making sure because that's the only thing I feel safe about. We clean off when we get Chinese food, we clean that off when we get in, but then we just pour it on a plate. And I just want to make sure we're still good with that. So speaking of outdoors, what are safe or safer activities for kids to do? Because I know people are returning back to sports and now we're having to have recess. And so what are some things that I need to be less concerned about?
Great question. So yeah, again, it's hard to know 100% answer, but generally things outdoors where they can maintain some distance. So, sports like soccer, baseball, where they're kind of staying away from each other, more contact sports like wrestling, wrestling, football, basketball, where they're kind of in closer quarters and, that might be a little bit more high risk. Swimming is generally okay. So they don't think that water is a source of infection, but as long as in the pool you're able to maintain social distance,
right.
So as long as you're kind of away from other people. Like outdoor picnics and things like that, I think are fine. I would still be a little careful of playgrounds and places where young children are going to be touching surfaces because, again, those surfaces could be contaminated. So you kind of want to stay away from those things.
Yeah. Do we know how long surfaces are contaminated? So, if...
I don't know. I know early on they had done some studies, and I think certain surfaces that are more porous, like plastic versus cardboard versus stainless steel. I personally don't know the recent research on that.
Yeah.
But I think it could potentially live up to a couple of hours on a surface is the last I heard, but that may have changed.
Okay. Good to know.
Going back to tennis, babe. Tennis.
Well, I mean, I bought 2 rackets for the family because I was thinking this is a great thing to be able to do, and you can't help but social distance unless you're like really good and you're heading up to the net and all that. But that's
I was pretty good.
I was gonna say that would be you.
I was?
Yeah.
Yes.
So, Dr. Anwar, who's at greatest risk for serious illness from COVID-19?
So, good question. And again, that's not an easy answer either because, this virus is not really following the typical rules. But what we know is, so especially for kids, but anyone who has underlying heart, lung issues, those people are more at risk. So for kids, it would be things like asthma or if they had congenital heart disease, illnesses like that. For adults, well, also for kids, it seems to be obesity is a risk factor. So kids who are obese are more at risk. For adults, it's things like high blood pressure, diabetes. But we've seen some people with those underlying illnesses get sick and they've actually done really well. And then we've seen other people who've been healthy and not had underlying medical illnesses become really sick. So it doesn't follow the rule all the time, but that's kind of the general rule of thumb is it's people with underlying medical issues that we're more concerned about.
I'm curious. I did see that people with neurological diseases such as dementia are more at risk. Do you have any idea why? This is really just an aside. Obviously, none of our kids are dealing with
I
that.
don't. I would think it probably has to do with age too. Now, I mean, the virus has definitely been shown to affect all parts of the body. So it has had neurologic complications. It's had hematologic, so it affects like clotting and all of those sorts of things. So that it may, I don't know if in patients with dementia, it might, it might affect their brain more that way. I'm not sure about that.
You made me think of something that I would love for you to address is, we've had multiple people that we've talked to who have said, I'm young, I have no underlying conditions. And so if I get coronavirus, I get it and I'll probably be fine. Can you speak to some of the long-term concerns that doctors are saying could happen as a result of people who maybe even are asymptomatic can have long-term conditions?
And it's true. I mean, and yes, there's a good chance that those people might not, they might get it and they might recover. Yes, but we are seeing a lot of long-term complications. So people that are now having like aches and pains and chronic headaches and fatigue and all sorts of symptoms like weeks and months after the initial infection. And it's kind of baffling doctors because we're not really sure how to treat it. And again, we're kind of learning this as we go along, but it has been shown to have long-term effects on the heart, the brain, so there can definitely, the lungs, so it can definitely cause serious complications that might be long lasting well after the disease. And we don't know who that's going to happen to. We just don't know.
And that's the thing that I thought was so interesting is they're saying that can happen to people who are asymptomatic or have very mild symptoms while they're infected with COVID-19, and yet and still you might end up with something that's going to last you till the rest of your life. Yeah. I'd love to know if we can build up immunity and protect ourselves better by doing certain things from coronavirus. Because originally I saw people saying, yeah, I'm, taking more vitamin C, and I thought that's dumb. I mean, it's a major pandemic, and what, you're going to take vitamin C? But I mean, I'm hearing that that's actually a thing. So can you address that?
Yeah, so, and I get asked that generally anyway about boosting a child's immunity. There really is no way to do that per se, okay? I think, again, we go back to the basics, which is you have to be washing your hands, you have to be wearing a mask. These are the best protective measures that you have. But there are some recent studies specifically about vitamin D. So I think something came out recently saying that people with vitamin D deficiency were more at risk for to have severe complications from COVID. So we've always known vitamin D does have some benefits for immune health. So that is definitely a vitamin. I recommend that for any kid anyway, because basically every child I check, a vitamin D level is deficient, and adults the same. So we would all benefit from a vitamin D supplement. I think there have been some studies looking into zinc as well. Zinc has also been known to be something that if you take in when you have the flu or have a cold, it may kind of shorten the duration of your illness. I don't think we haven't done any studies on any of these things in regards to COVID, but these things won't hurt. Vitamin C can also be a potential immune booster, but even probiotics, things like that. People ask me about those things all the time. And when they look at studies, they really don't show to have any major effect on the immune system, but it won't hurt to take them.
Right. Yeah.
May not benefit you either.
Okay. So practically, just talking to our audience here, what is the best and practical ways that children and adults can reduce the spread?
So number one, hand washing, frequent hand washing, and limiting your social contacts the best you can. I know it's hard. We're going on several months of this. People are anxious to get back to normal life, but unfortunately, I think this is the new normal for the time being. I don't see this ending anytime soon. So I think part of it is we have to learn how to resume regular life and normal activities, but doing it in the safest ways possible. So, I mean, personally, my children have not been into a store since March. They haven't been to a grocery store. One of us, either myself or my husband, goes. We try to go once a week. We try to do pickup at Target whenever we can. We do Amazon delivery when we can. So I think just limiting the exposure, limiting the time outside. I mean, in a public place, the best that you can. And you can be outside. We want kids to get fresh air. We want them to exercise. There's lots of activities you can do that are safe, like hiking or kicking a soccer ball in a field. You know, lots of things you can do where you're not around other people. So yes, distancing yourselves. I think it's hard. We're all social beings, and I think people are struggling with that. So we do have a small group of friends that we get together with who we know are generally being safe. And when we get together, we try to be outdoors and we try to spread ourselves out as much as possible. It's not always perfect, but we do our best. And obviously there's still a risk with that. But I think part of this is just learning how to safely navigate, because this is not ending anytime soon.
Yeah. Let me ask you, if you are 6 to 8 feet distance from a person, you're outside, do you need a mask?
That's a good question. And I wouldn't feel comfortable saying 100% yes or no. If you are socially distanced 6 to 8 feet, you probably don't need a mask, but it's also hard to maintain that distance the entire time you're around somebody.
I agree.
So I think it would be taking extra caution to wear a mask and just reducing your risk further. But yeah, if you can maintain a social distance of 6 feet, you might not necessarily need to wear a mask, but it's hard to say that 100%.
And it doesn't hurt.
Yeah, it doesn't hurt.
You mentioned earlier that there's very few people that medically cannot wear masks. Can you address any situations where you know somebody can't wear a mask?
Really, the only thing that comes to my mind straight would be a child with developmental delay or sensory issues where they struggle to keep a mask on, or they would struggle to put a mask, to put it on or take it off. That would really be the only scenario that comes to my mind. Parents have asked me about kids with allergies and kids with asthma, and there is no reason that a cloth mask over their face should affect their breathing at all.
Right. Yeah.
Okay.
And,
one quick question, babe. Mm-hmm. So the quality of the mask, does it matter if you're wearing socks, underwear, a mask, or up to medical grade, N95? My wife and I were watching a movie, and this woman caught this woman's underwear panties. Said, "Oh, it's a mask," and so she put on her face. It was a hilarious scene in the movie. She put on this mask. It was like a little teddy, and she was wearing this mask on her face. It was hilarious. What is quality? I'm just saying, what is quality masking? If you're gonna really be safe, it's like I saw people look like they were wearing toilet tissue on their face. They might have just been blowing toilet tissue.
Yeah, I mean, so it doesn't have to be medical quality. Regular people don't need to be wearing an N95 mask. That's really for medical professionals who are like in contact with potential COVID patients or known COVID patients.
What about teachers?
Teachers with an N95, I don't think that you do. I think actually generally any decent mask that is at least a thicker layer that's going to cover your nose and mouth. But then that's the other part of it, is people need to be wearing it correctly. I can't tell you how many people I see who have the right here below their nose.
Just take it off.
Yeah, or it's like a tiny little thing that's barely cut. Today I saw one that was like a string, and it's like a little plastic see-through like thing like this with like strings that go over the ears. But I was like, what is that actually? Because it was hanging in front of the face. So I was like, what is that actually even protecting? So it really needs to be covering your mouth and your nose, so that as you talk and breathe, you are not dispensing particles, nor are you breathing in anyone else's particles. Now, it's not going to be 100%, obviously, but.
You're right. I have a question.
Yeah.
if you have a face mask, I mean a face shield, do you need a mask also?
I would say yes. I think a face shield is not going to be as protective as a mask will be, because the mask is really covering your mouth and nose. A shield is kind of coming forward, and you are covered, but you're not really actively covering the mouth.
Right, there's gaps. I've seen a lot of people that don't have masks on, and that makes me uncomfortable.
Exactly.
Yeah. And really, I just have one last question. And, you know, vaccines are such a hot button topic with parents sometimes. And we know we're being told that there's multiple companies that are in the process of coming up with a vaccine. So will you automatically offer a vaccine to your patients when one is made available? And how can we as parents feel safe about the vaccine?
Yeah, so that's a great question. And we as medical professionals are also going to do our due diligence and our research to make sure that a vaccine is safe. Generally speaking, a vaccine is not put to market until it is rigorously tested. Now, that regular testing takes years. I mean, it takes almost a decade. That's not going to happen in this case. It's going to be a little more fast tracked. But they have to provide data to show that it's safe. And there's lots of trials going on right now. I actually had a family come in this week who their mom works at an office, and they are part of a clinic that's helping with a trial for Pfizer. So they have patients coming in regularly and getting either a COVID vaccine or getting a placebo, and they're having them come in weekly to monitor them and check for any side effects and symptoms and all of that kind of thing. So it is rigorously tested, but I will obviously still want to do my own research and look at the data to make sure that it's safe. But I think in today's day and age, nobody would put out a vaccine without knowing that it's safe. Now, is the vaccine the answer to all of this? I don't know that that's true either, because we don't know how effective it's going to be. Just like with a flu vaccine, even on a good year, we reach like 60, 70% effectiveness. So it's not 100%, but the flu vaccine still does provide some protection, where, like we were talking about earlier, the people who get the flu vaccine are definitely not as sick as the people who don't get the flu vaccine. So I think a vaccine is important and it's necessary, but the safety is absolutely number one priority.
Yeah, and hopefully they are, and I'm sure they are at the same time parallel pathing a treatment that will keep more people out of hospitals and having the severe adverse effects. Because that's another thing that I'm kind of waiting for is, is there going to be some sort of treatment that's going to keep my son and me from having to be on a ventilator?
Right. Because right now there really isn't. It's because it's viral. It's mostly supportive. There are a few medicines that have been shown to be effective, but generally they're used in like the most ill patients in the hospital.
Mm-hmm. Yeah, and there is a drug, hydrochlorine. What is the drug?
Hydroxychloroquine?
Yes.
Hydroxychloroquine, yeah. So there's been a lot of debate about that. Initially, they thought that it showed some progress. They've looked at that, and they've done several studies that really don't show it to be beneficial. So most doctors don't want to prescribe it. I think it's one of those things that's making the rounds on social media, that it's like some miracle medicine and doctors are withholding it from people. But when you look at the science behind it, it's just not there.
Yeah. Okay.
Okay. Hold on. One last question. So how can parents model for their children? What I see is, typically the parents do what the children do what the parents do as far as there's safety practices. What are some tips you can share to encourage parents who maybe hesitant or haven't in the past to begin to model for their children how to practice social distancing and proper wearing a mask? What would you say to those parents who may be still on the fence about that?
Yeah, I would say go for it. Like, kids are so smart and they're so resilient, and they really understand. They understand everything that's going on. There's several times my own children will be talking about something and they'll be like, oh, we can't do that now because of COVID, or we have to wait until coronavirus is over, so they get it. Mm-hmm. They need reminders, obviously. My older son is a little better at keeping some social distance. My little one kind of wants to get up in everybody's face and doesn't get it, and we have to keep reminding him. But you want to be honest with them, and you want to tell them what's going on, not in a way that scares them, but in a way that just keeps them informed and gives them some ownership of their own health. And again, hand washing is a big one. And that's easy. And teaching them how to wash their hands properly, washing hands frequently, teaching them how to wear a mask and be comfortable with wearing a mask and why we need it, to show them that it's not scary. But kids are pretty smart and with it. And they seem to be like handling it all really well, actually.
Chrissy turned to me the other day. She's our 7-year-old, and she said, "Is this your first virus?" And I said, "Yeah." And she said, "Mine too." I just thought that was so sweet. Well, Dr. Anwar, this has really been enlightening and very helpful information. Thank you so much for joining us.
Thank you for having me.
Yeah, unfortunately,
Yes,
we are out of time, so we appreciate all that you're doing. So thank you so much for being one of those frontline workers.
Thank you. Thank you so much.
Sure.
We'll see you at our next Well Kid appointment, okay?
Okay,
yeah, at the end of this
good.
month. Don't leave quite yet. So Noggin Educational Foundation is the premier sponsor of School Days. So we always want you to know what's going on with Noggin. So today is North Texas Giving Day. North Texas Giving Day is an 18-hour giving event benefiting local nonprofits here in North Texas. Each year, your North Texas Giving Day donations help with a significant portion of the funding we need to operate our free tutoring program, and this year we will use some of the donations to help fund our new ARD advocacy program. And our ARD advocates support parents by helping them get the services and accommodations their kids need at school for learning disabilities or special needs. With the closure of schools, the education gap for low-income students has widened, and the one-on-one intervention we provide is that much more vital. Your support on North Texas Giving Day today has an immediate and critical impact on our ability to serve our amazing students. So you have until midnight tonight to make a donation. And so you can go to our website, nogginfoundation.org, or schooldayshow.com for details and to contribute to our mission today. And if you're watching us online, I have had this on the screen the whole time. You can go to northtexasgivingday.org and search Noggin. We do want to give a special thanks to our corporate sponsors for North Texas Giving Day. So those are the Flying Squirrel Coffee Company, Social Realty, Evolve Credit Repair, Soldier Boutique, and Dr. Anwar's Practice Pediatric Center of Grand Prairie. So thank you so much, Dr. Anwar.
All right.
You're most welcome.
So as always, head to our website, schooldayshow.com, for more information about all that we're doing with Noggin and the resources mentioned on School Days. Remember, you don't ever have to miss a show. Find us on Spotify, Apple Podcasts, Google Play Music, and pretty much anywhere you listen to your favorite podcasts. And don't forget to follow us on Facebook, Instagram, and Twitter at Noggin Foundation. That's Noggin. Next week, we've invited two experts in learning disabilities and 2 in special education to talk to us about virtual learning. Also joining me in the co-host seat is Shelley Scraver, who is a mom with children with both special needs and learning differences. She has a unique perspective on the needs of students like these in a virtual learning environment. So tune into our show at our regular time and day and time Tuesday at 5:00 p.m. Central Standard Time, and make sure you tell your friends. And lastly, we always want to say that David and I are parenting by grace. We depend on God to give us the strength that we need to help our kids grow into flourishing adults. And if you would like to know more about that, please feel free to email me at info@schooldayshow.com. Have a great week and stay safe.